Hey, you guys, this is your girl, Dr. TOD. Good afternoon. Good afternoon. I wanted to come on and jump right in and talk a little bit about what's going on around our USA regarding healthcare. And as an eye care provider, I wanted to be able to talk to you guys about the changes that's happening in legislation related to your eye care, your vision care, your dental, all that stuff, right? Vision care, dental care, and regarding Medicare. So if you know of your seniors and things of that nature, share this with your family and your friends. Just share, post, because I think this is crucial. This is crucial. So pay attention today. So one of the things that I'm passionate about, of course, is that I'm an eye care professional. I've been in the field of optometry for over 20 plus years. And one of the things that I've seen over time is the takeover with large corporations as it pertains to eye care. So our micro businesses as boutique offices are heavily impacted by the larger companies taking over, especially now that we've moved into virtual spaces, online, and things of that nature. However, there's still a sector of the community that is still being underserved. And that is, of course, our seniors. And so I often find myself explaining insurances to many of the senior population because the verbiage is so confusing. And so now that this legislation may eventually be passed, it may become more confusing than ever. However, this is going in the right direction, because for all this time that I've been in healthcare, Medicare did not cover routine eye care, nor did it cover glasses. It was technically the health maintenance organizations, such as they have HMOs. That's what health maintenance organization. It has they're the ones that kind of dictate how you're taken care of, right? So Medicare was a whole different thing, because Medicare was traditionally just for government employees. And then I believe early on, they were able to pass legislation to open it up to anybody that was 65 and older. And now, depending on your generation, you may not be able to get your full benefits of your Medicare until, like myself, I think I have to be like 72. So it used to be 65. So with the new generations, it's going up. And that's probably because we're living longer, X, Y, and Z. And they said that, Medicare technically is going to run out. But that's neither here or there. I think the best thing that you can look at is to make sure. I had this brochure because I did a workshop, and maybe I need to do it again. But you need to understand the difference between Medicare and an HMO. Medicare has two parts. Medicare has Part A and Part B. For the Medicare Part A, it's usually your hospitalization, and Medicare Part B is for your outpatient medical care, such as if you come to an eye doctor for glaucoma, cataracts, whatever. But it did not include routine eye care and glasses. Now you probably say, listen, doc, I don't get it. Why doesn't I get it all the time? Why I need glasses? I'm getting older. I can't see. I'm with you. I'm the eye care professional, and I'm telling you that you need glasses, or reading glasses, or bifocals, or you need a little bit of upgrade after you had your cataract surgery, and they only covered it once, right? Within the 12 months if you having cataract surgery. So one of the things that I really want you to do is really pay attention to the legislation. Make sure that that you follow it. I also want you to start really contacting your senators. And even maybe even write, Nancy Pelosi and all of the other people related to this legislation, so that you can be in the know. Again, I think this is in the right direction. However, I think there's going to be some pros and cons to it. So again, there's pros and cons to switching to an HMO. And again, with your Medicare, I always tell seniors, keep your red, white, and blue card. Stop going to the HMOs, but I get it. You know, the HMOs wrap up your health care in a nice, pretty bow for you. But as a eye care provider, some of the HMOs are really discount plans. So that's the other thing. Is this going, I don't know what's in the legislation, but is it going to be more of a discount plan versus whether or not it's going to be full coverage, or are there going to be separate plans and you get to choose? So that's something that you have to look out for. I would say for me, I'm happy to see that the government is going in the direction of, making sure that Medicare is covering eyewear and dental, because that was just like, didn't make sense. Why they take all this money out of your paycheck all your life, as long as you've been working, and you don't have the coverage. So it is going in the right direction. We just have to watch and see what's going on related to it. So I talked about the difference between Medicare and an HMO, right? And so a little tidbit about that, because I have this brochure that I created. So a little bit, if you're interested in it, just DM me and I can send it to you. So a little bit about how Medicare works, okay? So related to your Part B, which takes care of your benefits, right? Your outpatient benefits, not your hospital. It's usually 80% is covered by Medicare and 20% will be your responsibility. Now, that could be the same thing when they start introducing the eye care legislation, right? They may cover a certain percentage and then you're going to have to pay. The one thing I have to say, if you can see this, the one thing I have to say, and this is going to be for everybody, right? Insurance is not a guarantee of coverage. So even with the new legislation, depending on what it is, it may not cover everything that we want it to cover. So if they're introducing this legislation, yes, it might cover your frame. It might not cover it every year. It can cover it every 2 years or every 3 years, whatever that might be. It could be in the same vein as diabetic shoes. And I'm praying and hoping. So here I'm talking to my legislators for a micro business in a boutique office like myself, who was told that I could not use my durable medical equipment provider number because I wasn't using enough. And so then it was like an exorbitant amount of money just to get back on to be a durable medical provider. So I'm hoping that this doesn't go through the durable medical provider side, because that's going to knock a lot of small optometrists out of it. We're already getting knocked off because of the larger corporations. And so that brings me to the second point. Again, it's the needle is moved in the right direction as it pertains to Medicare or legislation being posed to have eye care. However, the larger industries, they're sharks, and they're going to capitalize on really getting that Medicare money. But here's the thing. You can't mess around with Medicare. So you got to cross every T and dot every I, because that's government money. So the only catch-all with that is because we have so many larger companies that are dealing in the eye care industry. How will this affect the smaller businesses, as well as how will it affect them? So that's kind of one of the things. So I believe also it's just my notion. This is Dr. T talking. This is from my perspective, that your Medicare premiums may also go up, because how are we going to pay for this increase in services, right? Your premiums may go up as well. Okay. And so again, this is good because it's taking care of more services being able to take care of our seniors. However, we really need to look at the fine print to make sure that it's really doing what it's supposed to be. So, Representative Sanders, thank you for your initiative, but I pray and hope that that this is going in the right direction, and this is not just a smoke screen, that's going to still be able to really help those that are less fortunate and underinsured or non-insured, or whether or not it's going to be part of your Part D, your medical, who knows. But please let us know how that's supposed to work out, and hopefully maybe we can, as current providers, be grandfathered in to getting on this durable medical equipment, because that was one of the reasons why I didn't do the durable medical equipment, was because I wasn't getting I wasn't having the patient flow that really needed the surgery for the glasses. So prayerfully it will come off of durable medical equipment. That would be my recommendation, that it comes off of your durable medical equipment and go into your care, your Part B. Okay. So I highly recommend that you write your legislation, you check up on this and look on it, and look at your plans, people. Look at your plans. Because I'm going to put this up again, that insurance is not, a guarantee of coverage. So let's look at some tips. So one of the things I told you about, that it's a health maintenance organization, right? And so when we're looking at this, you want to be sure that it's covering what you need it to be covering. So whether or not you're going to stick with your traditional Medicare or your HMO, that could be the other piece. The missing link with this too is if the Medicare is starting to cover, then your HMOs might suffer from that as well. Okay. Some of the HMO plans might change as well. So we really have to look at all of this. I always say stick with your red, white, and blue card, because it's taken out of your money all the time. And the other piece of it is the HMOs dictate how your medical care is being done. So that's why it's called health maintenance organizations. It's maintaining the monies, not technically your health, but it's maintaining the monies that Medicare gives to them to take care of you. So there could be some adjustments in that as well. Again, the shift is going in the right direction, but I'm hoping that they're talking to the right people, especially those that are in inner cities, that have a large senior population, that really need to talk with the seniors and find out what exactly is going to be coverage. And no hokey doke language or anything like that. We need to know what exactly is going to go down. I know as an eye care professional, we always find ourselves explaining so much related to insurances, and when we shouldn't have to. We're in a position of taking care of the patient. So again, legislation is going on the block to be able to be approved. Prayerfully it will be, but I would have to figure out how to get in and look at the legislation and see what exactly is on the table. I know that most recent article was in our review of optometry, to kind of go over what those benefits will possibly be. So it looks like it will be kind of going toward the Part B, but the Part B is voluntary. But the vast majority of Medicare's more than 60 million beneficiaries sign up for Part B. So their premiums, and most people now pay a little over $150 for their premium monthly. So while not cheap, that actually is considered a good deal, because taxpayers cover 75% of the overall cost of the insurance. So hear me out. Our taxpayer dollars cover 75% of the insurance. So premiums would be expected to rise. I said that, with richer benefits, but the cost would be spread broadly. So again, there's going to be some piecemealing here. On a side note, most people with private Medicare Advantage plans now have some level of dental care but that can vary greatly. If dental, vision, and hearing benefits were standard under Part B, the Medicare Advantage plans would have to provide them as well. So what kinds of services would be provided? So the vision coverage, I can only talk on vision. The vision coverage would include eyeglasses and contact, plus the need for exams and fitting. Okay. And so again, it's unclear because the key details, such as the scope of benefits, I talked about that, and the cost sharing by Medicare benefits have not been determined. Okay, it has not been determined. So the coverage expansion was a part of a broader legislation that would have empowered Medicare to negotiate prescription drug prices. Some of the savings from drug costs would have been plowed back into the program. So why does Medicare cover? Why doesn't Medicare cover dental? So experts say the probable reason is back in 1965 when the program was created, right? It didn't have that model in it. It's modeled after kind of private insurance that where it's most available for your medical care. So again, Medicare didn't, or those that are in legislation did not see that routine eye care or glasses, I have air quotes, was considered, was considered medical. So I always have to give that. And they're like, that makes no sense. I always have to tell it that way, is because they did not consider routine eye care and glasses being considered as medical. So yes, there's a big gap in coverage. There is definitely a lot more work that needs to be done. But I just wanted to give you that information and come really quick with this quick breaking news related to the eye care industry. So for me, it sounds like it's going in a positive direction, because I'm on the forefront of, or the beginning process of transitioning more into the medical model, because I didn't see a benefit for doing eyewear, because my thing is making sure that your eyes are healthy. But now if I see that Medicare is going in the positive direction, then that might help. It's a catch-22. You're blank if you do, and you're blank if you don't. So it all depends on, how do you want to proceed? How does the government want to proceed? And read the fine print on what that is. Again, a lot of times with the vision care, it's more of a discount plan. So maybe this, again, will be bringing the needle a little bit further, that you don't have to come out your pocket, that you'll come out your pocket a little bit more for the premium. But again, it's something that's on the table. We don't know exactly what's going on, but I wanted you all to be informed, because that's what it is about, to be informed. So again, this is your girl, Dr. TOD. I'm here to bring you some breaking news related to the eye care world. We'll see what happens. But I know for sure that, legislation is going. I know, there's a battle between Republicans and Democrats. But at the end of the day, our seniors need to be taken care of. There are so many countries that take care of their elderly population, and we're ones that don't do a good job at it. So this is your girl, Dr. TOD. I hope that this added value to you. Share this information. It's related to the new legislation. If you're just coming on, it's related to the new legislation related to Medicare that may be coming down the pike as it pertains to eye care. So Medicare may start providing those services for us. But again, we have to make sure, we have to read everything to make sure that we understand what's going on, because Medicare can be confusing. All right, this is your girl, Dr. TOD. Be blessed, and I'll see you guys on the other side.